April 2021 Board of Health meeting to order. It is 8:05 a.m. We are joined by, this is Deanna Damore. I'm the health director for the city of Norwalk. We have Terry Quell, Ken Lalim, Norman Weinberger, and Vincent Amaruccio, who are Board of Health members. On staff, we have Megan Fogno, Teresa Argandazzi, and Brian Weeks. Good morning, everyone.
Good morning.
Our first item on the agenda is the approval of the March 23rd, 2021 meeting minutes. Do we have a motion?
Motion.
So moved.
Okay.
Second.
Second by Terry. All right, great. Any comments, edits, any discussion around the minutes? All right. All in favor, say aye.
Aye.
Any opposed? Abstentions? All right, minutes pass unanimously. Thank you. The next item on the agenda is public participation. Megan, do we have anybody? If anybody would like to speak, please raise your hand, or I think we have a phone number. No.
Yeah, we have a phone number. Should I unmute them so that they can?
Yeah, do you want to unmute them in case they would like to speak?
So you're unmuted. You can unmute yourself now if you'd like to speak.
Hi, that drive fighting in while I'm driving to the office.
Oh, hi, Dr. Karpiak.
How are you?
I'm glad Megan unmuted you. All right, awesome. And we have Dr. Karpiak, Board of Health member, joining us. All right. The next item on the agenda, I don't see anybody else, right, Megan? There's nobody else.
No, and Dr. Karpiak, I muted you, and then just unmute you if you need to talk.
Okay, great. All right, next item on the agenda is the director's report. So I want to share some great updates related to funding. So the governor had put his proposed budget together, and as you know, local health departments have per capita allocation from the state. So for municipalities, in state statute is written that local health departments with a population of greater than 50,000 or districts with 3 or more towns or a population greater than 50,000, they get money allocated to them. So for municipalities, they're granted $1.18 per capita. The past several years, there's actually been a 10% reduction of that given to local health departments. And so health directors and other health department staff have been advocating for local public health funding for several years. And the governor in his proposed budget still had us at level funding, which was at 10% cut from the $1.18. But the appropriations committee at the legislature, they put together their proposed budget, and they're asking for municipalities to get $1.93 per capita, so to increase the per capita funding. And so that would result in a difference. If we were fully funded with $1.18, we would get about $105,000 a year. And with this increase, I calculated out to about $172,000 a year. So it's an increase. And so not sure where this is going to go at the state level, but wanted you to be aware of this. We haven't had this level gone this far in a long time in terms of seeing the state wanting to support local health departments more, and to really recognize that the foundational infrastructure really needs to be there in order to respond to emergencies, pandemics, other infectious diseases, just really any public health issue in the now and in the future. So really excited about that. So wanted to share that with you all. The other thing is the governor released his plan for the American Rescue Plan Act funding just yesterday, some updates. And so in his proposal, he did include some additional funding for local health departments. And so I'm just pulling it up right now. He included for 2 fiscal years, $5 million in addition to local health departments. And so there is a note in there about a match from locals. So I don't know exactly what that means at this point. So we're going to be following up with the state, but he is looking to include additional funding for local health departments. Not sure what the allocation will look like, but I saw that yesterday. And again, great news to see that funding for local health departments. The other thing is we're also been working on other funding proposals. So staff, we worked on a proposal for vaccine equity funding. And Ken, I know you had shared that with me as well. So we had put together a proposal in partnership with the Norwich Community Health Center, the Community Health Center Inc., as well as the Family and Children's Agency for funding for us, and then also to them to support vaccine equity work. And so we haven't heard back from the state yet about if we're getting funding or what that allocation will look like, but we'll keep you posted. But the idea is to support our homebound, bedbound program, which I can talk a little bit more about later, give some updates related to that. And then also just having, the model is changing. We need to be more out into the community. It's going to be transitioning from these mass vax sites to getting out into different locations within the community, being able to continue our work with, offering different, not operating all the time within the work day, the typical work day, being able to do evening hours, which we've been doing, and offering more of that, as well as some weekend hours too. So we put in a proposal for that. And then Teresa was working with the Family and Children's Agency because, we have the community health worker program. So we're also looking for additional funding opportunities to keep that program going for a longer period, because it's been really successful. It's been a great partnership with them. It's been really great. Teresa, anything to add related to the community health workers? I know there's a lot of different funding opportunities coming down from the state. So she's been coordinating with the state health department too, like who's applying for what and what can we collaborate on together for proposals.
Hi, sorry, I'm on my phone and couldn't figure out how to unmute myself for a second. But no, I don't have anything to add, just a lot of opportunities. I have a meeting this afternoon with someone from the state who wants to learn more about our community health worker initiative to see if there's any additional funding opportunities that can support it. And so we're just trying to figure out how we can maximize the opportunities that are out there and, not duplicate resources and align everything that's going on in the community, because there's a lot of great work happening. So that's all.
Thank you, Teresa. All right, any questions related to anything with funding? Any comments? All right.
Excellent work. I know that's a lot of work to apply for all that funding.
Thank you, Terry. The other thing before we move on to more COVID specific updates, I just wanted to make sure you all are aware that the mayor is going to be hosting another town hall this Wednesday on Zoom. And this one's going to be focused on mental health awareness and available community resources. So I just wanted to highlight that for everyone. I think it's going to be a really great town hall. And the commissioner of the State Department of Children and Families will be on that town hall. So it should be really, really great. So excited about that. All right. Our next item on the agenda is COVID-19 updates. And so I'm gonna give some updates related to vaccination, and then I'm gonna turn over to our new epidemiologist, Brian Weeks, who's gonna give you a data update. So really excited and fortunate to have Brian join our team. He really has hit the ground running. He has many years of experience working in a local health department, and so we're really fortunate to have him on our team, and really just was able to just get to work right away and just really run with everything. In terms of our updates related to vaccine, before I turn it over to Brian, we have now administered almost 10,500 vaccines. We're just under that right now. We celebrated administering our 10,000th dose this past month. It was really a great, opportunity just to quickly celebrate with our volunteers and our staff for all the hard work that they've been doing. So that was a really fun moment for everybody. It's interesting to think about how many vaccines we typically administer, throughout a year, between flu and our routine adult and childhood immunizations, but to think within such a short amount of time to be able to administer 10,000 doses, it's a really great accomplishment. We're continuing our clinics at the Bowtie Cinema. We have another clinic this Wednesday. We're offering evening hours because we know much more convenient for the public. So from 4 to 7 p.m. We've started to accommodate more and more walk-ups because we know as the vaccine becomes more available with appointment slots and being in a location right in the community where people can walk up, it's really been great. So last Wednesday, Teresa, Megan, correct me if I'm wrong, I think we had over 100 walk-ups for that clinic.
119.
119, thank you. And so we are encouraging appointments because it's easier for our planning purposes in terms of how many vaccines to bring, but we are now just saying, please walk up for these clinics so that we can vaccinate you. Last week, we also had what we termed Vaccine Week in Norwalk. And so the state health department reached out to us, letting us know that the Griffin mobile units, the partnership between the state health department and Griffin, were available to come to Norwalk. And so of course we jumped at the opportunity. And so they were able to offer walk-up appointments at both the main branch of the library and the Sono branch, as well as the Carver Center. And so those also did really well. The state health department and Griffin were really happy with the numbers of people that came out in Norwalk. So I think that really goes to show the amazing team we have here and all the amazing community providers and the mayor's office and everybody and Lamont for getting the word out about the vaccines. So in total, there was about 850 doses administered last week through that effort. So very successful. And I want to thank Megan and Corey and some of our other staff who helped assist with those efforts, really helping assist with making sure, the setup, everything was going smoothly, assisting Griffin and the National Guard, as well as the library staff. They really, they helped a lot too. So that was great. Obviously they didn't have experience working in a clinic before, but they really jumped in and were helping. And Lamont as well was helping at that clinic too. So I think that's it related to vaccines, unless Megan or Teresa, if you have anything to add. All right.
Nothing to add for me.
Okay. Any questions, comments, discussions related to vaccines?
It's just a comment about, nationally, they're seeing a decrease in people wanting to get the vaccine. How's Norwalk in terms of that? How are we doing?
So we have been seeing, before when we used to post the clinic, it would fill, like we had one clinic that filled in 15 minutes. We had some others that filled within 3 hours, but we still have open appointments for our clinic this Wednesday. So we are seeing that decrease, but we did see a lot of people come to those Griffin units last week after work. And so I think that's the shift, is it's like making it convenient for evening hours and weekend hours, because now we're at the younger population, who are working. So I think now we have to just make it as convenient as possible for people.
Almost to take it to the work site, because a lot of these people don't have the ability to leave work for the vaccines.
Yep, that's an excellent point, Dr. Weinberger. Teresa and I were talking, it's like, we have for flu clinics, we have our worksite program. So it's almost like, do we have to look at that and model that for COVID vaccine?
And my guess is by the next round, if it's later this year or the year after, it's going to be all together. You're going to get vaccinated for everything all at the same time. Then you merge all those ideas that you have will be merged. So.
So that also reminds me, I know the state health department is looking at expanding the number of providers within the COVP within their program, because they're really shifting again from that mass vax model to offering it to more primary care physicians and others. So that is something that the state is working on too, that I wanted to bring to everyone's attention as well. So,
and isn't sorry, go ahead.
No, you go, Vince.
I was going to say, and isn't it now also being offered elsewhere? Like I know this weekend when I went to CVS, there was a large line outside of CVS. So I'm wondering if people are just shifting to other more convenient locations.
That's a great point. That is a great point, because at Costco, there's a lot of the pharmacies and retailers are now offering it. And you're right, like it is easy just to go to a CVS and, get your vaccine. That's a great point.
And do you have access to that data?
In terms of how many people are getting vaccinated or who's going to which sites, or?
No, how many people are getting vaccinated?
we're able to get summary data from the state health department. Brian and I have been requesting to be able to get the data ourselves so we can do the analysis here, but the state is doing the analysis for us. And so Brian, actually, that's in his presentation. So I don't want to steal his thunder, but that's actually a great segue to Brian's presentation.
Some of the data that people are looking for is the Black and brown communities. What percent of the doses that you're giving and that you're doing are getting to the right populations, or are we, if we continue to vaccinate, you know, a white group of stakeholders, then you're not going to get at what you have to get to. So we're actually being asked, okay, what percentage? And some of the health centers around the state are hitting numbers in the 50s and 60s, but it gets washed by so many people are at the mass vac sites, which are running at, you know, 8 or 10%. You know, so the overall percentage in the state is in the mid to high 20s. But it really needs to get a little bit higher than that in some of the locations in the state. So more to come. I've got to find more ways to get the people out. And you're right, it's later hours, workplace, all those things, pop-ups, all that kind of stuff's going to be useful.
Absolutely, Ken. And that is something that we've been requesting from the state as well. We want to know how we're doing by race ethnicity for Norwalk. And so they're working on that for us to be able to query the data, to be able to see. But yeah, you're right. It's by provider right now. You have to go by provider to see how they're doing. All right. Brian, are you able to share your screen? I don't know if you want to segue.
Sure. Hey everybody, Brian here at the health department. I am the epidemiologist. Great to meet everybody. My first time here at these meetings. So jumping right into it, this is just a very kind of quick overview on the status of COVID-19 in the city of Norwalk. So I like to kind of look at it from a zoomed in fashion. So right now we're looking at it from the county perspective. And so as you can see, based upon the recent state health department COVID-19 county indicators, again, it is limited to when the surveillance data is collected. So it's always going to have a little bit of a latency, so to speak. So this is reflective of April 4th to the 17th, the 2 complete calendar weeks of 2021. But if you look at the data, you know, Fairfield, Litchfield, and New Haven counties are the highest in terms of the leading and secondary indicators by county. And so you can see the leading indicator for overall for Fairfield County is at 32 for new COVID-19 cases per 100,000 of the population per day. So obviously we're a little high still, still not out of the woods yet based upon just this view. So moving to the next slide. As you can see, this is the case rates by town and city. Again, reflective of the data from April 4th to the 17th. So again, this is the average daily case rate. So you can see how red, which is 15 plus in terms of cases per 100,000, which is the highest threshold based upon the state framework. You know, red's definitely dominating, you know, very much the southwestern portion of Connecticut. So that's Fairfield, New Haven counties, especially, as you can see here. You can see actually what's been introduced in the recent, you know, week or two, a lot more yellow and orange. So actually decreasing in terms of threshold, being below that 15 plus for a lot of the towns and cities on the eastern side of Connecticut. So we're hoping that's going to make its way over here too in terms of impact, but also just keep in mind in terms of population density, that's another factor too, and why they might be experiencing a little lower number of cases. So right now for the city of Norwalk, we are at 35.9 cases per 100,000 of the population. The previous data point had us at 43.7. So actually a decrease, which is really great. And then kind of moving forward from a more kind of zoomed in version of the city of Norwalk. So this is just a very peripheral kind of data. This is definitely something that's going to be fleshed out more so in the future with our meetings. But, you know, just very in a summary in terms of number of cases based upon the state data from which concluded in terms of Sunday, April 25th, it's 11,278 total COVID-19 cases for the city of Norwalk, which was an increase from the previous 3 days, right? So that was Thursday's data of an increase of about 60 cases. So this data just came out yesterday. So even though it says Sunday, the state's releasing this data, you know, the following day in the early evening. But looking at it from the processing of the data right now in terms of age groups, this data is looking at the most recent 3 calendar weeks. So that's the time period of April 4th to the 24th. In terms of age group by decade of age, what's really interesting here, and it's definitely different from what we've seen in some previous weeks, just the age groups that are impacted, right, that are presenting with COVID and getting tested and test positive. It's pretty much, as you can see here, less than 50 years of age, right? And it's kind of almost on the same keel in terms of being almost like 15, 16, 17% for each of the age groups. What's significant here, especially, is the less than 20 years of age groups, which have entered a higher proportion than before. So definitely showing that, they're driving some of the potential for transmission as well as exposure, just because they're not fully eligible. Certain ages inside those age brackets are not eligible for the vaccines, as well as, they're going back to school, especially with the better weather, there's more mobility. And we were also seeing, especially with the increased case rates we were seeing in previous weeks, the impact and residual impact of spring break, right? So in terms of like college students or individuals that might take full advantage of the improving weather. But nonetheless, what's also significant too is, still at 12.1% for 50 to 59 in terms of the age groups. And then, at least for 60 plus, it's a very small segment of that in comparison to what we were seeing in the beginning of the pandemic back in 2020. But I just want to emphasize this in terms of messaging. We're definitely looking at the less than 50 years of age groups in terms of messaging and making sure that everybody's still aware of the prevention measures and where they apply. And obviously, if they haven't sought the vaccine, definitely getting vaccinated, because, that's definitely one of the most useful and helpful weapons in our arsenal against COVID-19. One other thing that's really important to emphasize, the thing that could always change the game for us is the variants. And so this is some data from the State Health Department as well as the CDC. So firstly, just talking about numbers in terms of variants, you have B117, which is the UK variant, B1351, which is the South African variant, P1 being the Brazil/Japan variant, and B1427, B1429, which are the California variants. These are the variants of concern. These are the ones we want to very closely monitor. Fortunately, we don't have any of high consequence, which is another classification the CDC has, but definitely the variants of concern always can, very much change the game. There's also variants of interest, but right now, obviously, we're focused on the ones of concern. So we're almost 1,000 plus based upon the data that was up to April 22nd from the State Health Department in terms of B117, the UK variant. A better way to look at it is in terms of proportion. So this is recent, it's recent analyses from the CDC, but it's 4 weeks up to March 27th. So it is still it's pretty much at a month old in terms of age. So obviously these numbers likely increase, but just to give us a rough idea where we're at until this is updated by the CDC, Connecticut has almost 30% UK variant in terms of prevalence. In terms of B1351, South African variant, almost about 1%, along with P1, the Brazil/Japan one, and the California variants, 427, 429, about 7.4%. So then all other lineages around, almost 2/3, but likely that's probably decreased in light of these other variants of concern really starting to present and spread in the population. And so what you see right here on the left-hand side, which is really awesome, it's a table that was put together by the CDC and kind of just outlines the characteristics based upon the current scientific literature and knowledge of each variant. So right here, and it might be hard to see because it is very small font, so I'll explain the high-level details of it. But, the big thing is obviously increased transmissibility. And so for the UK variants, the B117, it's about 50% increased transmission. So it's quite significant. And it's obviously demonstrative of how our case rates have got impacted once it got introduced in the United States and subsequently Connecticut and the Fairfield County areas. And so it's something to keep in mind. In addition to that, in terms of transmissibility, the South African variant 351 is also at about 50% increased transmissibility. The California variants 427 and 429 are about 20% increased transmissibility, not as high, but still obviously demonstrating that.
Right.
The other important thing to emphasize with a lot of these variants, especially B1351, even P1, 427 and 429, is the increased ability to reduce the effectiveness of some therapeutics, as well as the potential to have some impact on the vaccine. All right, the current vaccines that are available, so reducing their effectiveness. So that's another important point and why we don't want these variants to spread. So again, prevention measures being a very important part of that aspect. Nonetheless, obviously, it's important to emphasize the vaccine still helps even with these variants, helps reduce some of the severity of outcomes with individuals, whether reducing the need for being hospitalized or obviously the risk of fatality. So obviously getting those vaccines are still relevant even in light of these potential reduction in effectiveness of the vaccines. And so now, since I'm talking about vaccines so much, this is the data up to actually the 21st of April in terms of the state of Connecticut. And this is for individuals that have received at least one dose of the COVID-19 vaccine. So as you can see here, the current data for Norwalk is at almost 47%. And so the state's been processing this data in many different ways. And so it's really great that they've made this available. But in terms of, again, an individual receiving at least one dose of the COVID-19 vaccine, overall, it's at 47%. In terms of age groups, 65 plus, it's 83%. 45 to 64 is about 38%, and then 15 to 44 is about 12%. So obviously getting those younger age groups vaccinated more so, it's going to be a priority, but that's also just because they just became eligible in terms of this month, in terms of the vaccine. But nonetheless, we have a lot more opportunities to get individuals vaccinated now too. So that subsequently just leads to my final slide, get vaccinated. It's one of the best things we can do at the moment, and to really just stem the flow and the tide in terms of COVID, take full advantage of it, but then also just keep in mind prevention measures, as individuals interact more, especially with this really great weather that we're experiencing now. So just, keeping that in mind, because we're not out of the woods yet, and we want to make sure we don't go deeper into it. We want to go back out into better terrain. So just everybody just keep that in mind. So that's my presentation for today. Thank you again. Really appreciate it and really happy to be here.
Thank you so much, Brian. That was really great. Does anybody have any questions for Brian?
I have a question. Go ahead, Vince.
That's okay. Go ahead, Terry.
First of all, welcome. It's nice to have you on board.
Thank you.
I just had a question about the number of cases. Do you have any differentiation in terms of the number of cases versus the number of positive tests? Because I know a lot of people have had multiple tests and they're still positive. So I'm wondering if that's able to be pulled out of there.
Yeah, so in terms of processing that data, we actually have some other data from the state in terms of the number of tests versus the number of actual people tested, if you want to look at it from that perspective. So the number of tests are around 193,000 that have been conducted, and number of people actual tested, so unique individuals, it's estimated to be about 63,000. Number of those that are actually positive, don't have that number at the moment.
Okay, because there is some concern that data may be, and the data is the data, but that it may be a little bit inflated because one person might have 3 tests.
Oh, no, these are unique individuals when somebody does test positive, and it's based upon the current CSTE case definitions as well as modifications the state has made to that. But it should be for unique individuals, though.
Okay, great. Thank you.
Yep.
And my question was just, so going back to slide 7 with the vaccines and kind of connecting back to the question that Ken raised earlier, so is that a particular slide that once you get race and ethnicity information, you'd break out further?
Oh yeah, absolutely. Yeah. So we're waiting on the state. The state's been working on this. They just released the age group breakdown. They actually had to redo all their data sets because they have different ways of deduplicating and processing that data. But we're very much looking for. We're on the edge of our seats waiting for that race event this weekend. The moment we have it, we will share it with you guys.
I think
Excellent.
the state has a standard of, I think it's 50 zip codes that they were using as the benchmark that they were asking providers. I think the number was they were trying to hit 38%. I think that was the number of the underserved communities that are defined by those 50 zip codes. So all the providers are being asked to generate data at that level. So I didn't know if we could mimic those types of things as we go forward. The state should be able to provide that to us.
Yeah, and so I'm participating on the state's equity work group, provider equity work group. Myself and Leanne from Hartford, she's the Hartford's health director. We're the 2 health department representatives. And so as part of that participation, as you're saying, Ken, I've been pulling that data and we've been doing really well. I can pull that, I can share that with you all, like how we've been doing the past month or so of with our clinics, how we're doing both with race, ethnicity, as well as the high SVI zip codes. So we've
Great.
been able to meet our targets in partnership with our, our other community partners.
Thanks.
Any other discussion points? I do want to mention that Brian and I have been working really closely with the mayor in his office on updating the way the data is presented in the mayor's briefings. And really, now that we have Brian on board, making, improvements to them, be able to provide additional data to everybody. So that's something that we're working on and we'll be presenting to the mayor soon, based on his vision and our ideas for how we can continue to improve the data moving forward. So that's also in the works too.
Talking about the mayor, congratulations again on your front page little proclamation that it's your day. So congratulations on that. Great work to get to that point. I'm glad it's recognized.
Thank you, Ken. I really appreciate that. Last week was Volunteer Appreciation Week. And so the mayor read a proclamation for volunteers and all that they've contributed. And then he surprised me with the proclamation for me, but I really see it as a reflection of our team and all of the work that they've been putting in. Just incredibly fortunate and blessed to have everyone working with in Norwalk. It's just incredible, like the way everyone has really come together and really stepped up, and you can really tell everyone's passion and compassion for others and how much they've given of themselves to serve the community over this past year. So really incredible, inspiring.
Yeah, I think it really shows the value of public health. It really is, not an opportunity. Unfortunately, the pandemic doesn't come along too often, hopefully, but it does show how much we've been able to handle it. And great job.
Thank you, Ken. All right. Anybody have any other things they want to? I want to talk about personnel updates. So talking about our great team. So just wanted to give you some updates on where we are with filling some of these vacant positions. So we're in the process of interviewing for the Assistant Director of Health, Environmental Health. It's going really well. We have a lot of great candidates. We also, the city is going to be posting a Public Health Program Associate position soon. So it's been sent out to bid within the union, and it will be, if we don't have qualified bidders, then it will go out to the public. So I anticipate being able to fill that position soon. And that position is really going to provide support to me and the department, across the department, on different programs and initiatives that we have. So excited about that. I'm a real advocate for public health generalists, where you never know what issue is going to pop up and what we're going to need to address. So having somebody with those public health skills that you can apply to a lot of different areas. So I'm really excited to have an additional position like that be able to support our department. We also have the Health Operations Manager, which we've had several great applicants apply for that, and I'm currently looking through all the resumes and applications, so hoping to start those interviews soon. And then we're also going to be backfilling the health educator position. So Teresa's been working on that, looking to see if how that job description needs to be updated, because it's been over 10 years since it's been updated. So working on that as well. So continue to grow and enhance the team. So excited about that.
Excellent.
All right. Well, thank you all, as always, for your support and your guidance and your leadership. It's been a tough year, obviously, but we're all coming together and addressing it, and hopefully in the future just keep improving. Any other comments before we wrap up today?
So has the workforce, your workforce, all been vaccinated?
Many of them have, not 100%, but many of them have been.
Are you getting people that are not seeking the vaccine for their own personal reasons?
Yeah, just like anywhere, you have some people that are at this point are not wanting to be vaccinated, but for the most part, most people have jumped at the opportunity. And we have seen some people who said no initially, wanting to get the vaccine eventually.
Good. That's going to be important as statewide, that is an issue. It's, it's in the 20+% range. We got to try to get that educated population a little bit more in line, so.
All right. Anything else? All right. Thank you, everyone. Hope you have a great day today.
Thanks, you
Good
too.
day, all.
You too.
Bye.
Bye-bye.
Take care.